Okay, so with that, I think we'll move on to something of a little more timely and, in my opinion at least, a wholly more confusing subject matter, antimicrobial resistance, and really going to restrict this basically to the role that agriculture may or may not play in developing antimicrobial resistance of public health significance. So what I want to go through here relatively quickly is a very brief synopsis of how bacteria can acquire mechanisms of resistance, and then once that bacteria has resistance capabilities, how is it going to pose a risk to a person? How is it going to end up getting into a person? And considering we're at the National Institutes of Animal Agriculture, we're going to talk about it from an animal agriculture standpoint. Okay, and so if the resistance develops and emerges in food animals, how can it pose a risk to public health and human health? Try to put it into a little bit of perspective with a discussion of how much antimicrobials are used in animal agriculture, and are we able to, is that a large enough number to create a problem from public health, and then wrap up with a discussion of the scientific empiric literature that's available out there of whether or not agriculture plays a role in antimicrobial resistance. So a little bit of a clarification here. I'll use AR throughout the presentation, basically an abbreviation for antimicrobial resistance. Otherwise, all my slides get a little bit long. So how would bacteria acquire resistance to an antimicrobial or an antibiotic that would normally be harmful to it and kill it? The classic Darwinian way that we thought was the dominant pattern up until the last 15 years, couple of decades, the classic assumption was you have point mutations. You've got a gene in a bacteria, you've got a chromosome that codes for various proteins, the same as in any other animal or any other living organism, and you change those genes one point at a time, and then ultimately you have a phenotypic manifestation from that genetic alteration, and voila, that manifestation just happens to confer resistance to the antimicrobial that they used to be susceptible to. The important thing to recognize with this is it's a relatively slow process. Again, you're talking one step at a time, and you take one step and you say, do I live better or worse than my predecessor? Okay, I'll take another step. Do I live better or worse than my predecessor? And only as long as you're living at least as well or better are you going to survive, and it's going to take a long time before you get a whole lot of changes. The other thing is you're generally mutating at one target at a time, and so you may confer resistance to one specific drug or one class of drug, but if you switch up, if the physician switches up and treats you with a different class, you've outsmarted that bug and you've beaten him, because he was going one step at a time, and he's not going to be able to alter multiple targets. What we figured out in the last 15 to 20 years is this, while important, really is not the predominant driver of resistance. What we see as the predominant source of problems is this acquisition of new genes. Okay, what you'll hear talked about is swapping genes. That bacteria are able to take very large chunks of DNA and acquire them from other bacteria and share them quite readily from a number of different mechanisms, and gain whole new attributes in a moment's time. And so the other thing that this brings is this may confer resistance to multiple compounds and classes, either by acting the same way. So there are some that are basically efflux pumps. They're grabbing antibiotics and they're throwing them out of the cell. Okay? And it may grab tetracycline just as well as it grabs gentamicin or any other product and grab it and throw it out of the cell. So that's one way it can do it. But the other way is that sometimes it's using different mechanisms, but they all get lumped together into the same string of DNA, and once the bacteria pick up that string, they've got all of the different resistance mechanisms. So this is really the thing that we're looking at. And again, there's a number of mechanisms, and we don't have time to go through those. But this really is the recognized path of greatest concern at this point of how bacteria are developing resistance. Once that organism has the resistance determinants, how then does it pose a risk to human health? Well, one that we really talk about and point fingers at from the animal agriculture standpoint are these hospital-acquired or healthcare-acquired or nosocomial infections where humans have been using antibiotics, they've stimulated the development of resistance, and then they share it from one human to another. Because we're talking again about animal ag, we're not going to talk about that any at all, so we're going to focus on these two. So what are the routes that you can get it from animals to humans? One is basically direct transfer from an animal. And you can have that occurring from kids going out to the petting zoo or going out to the dairy farm, just like Bob talked about with the raw milk. They don't even have to drink raw milk. Maybe they pet the calves and they pick up these organisms, and these organisms have been exposed to antibiotics in the farming environment. So that's a potential route, but most commonly it's associated with contaminated food. It's assumed that it was in the animal's environment, and then once that animal is processed or the food product is derived from that animal, then those organisms are contaminating that food. Then an important note here is that the organism must be capable of infecting animals. Whether or not they cause disease, they have to be capable of infecting animals and then ultimately causing disease in humans. And there's a relatively large number of organisms that can do that, but certainly not all organisms. Certainly not all organisms that we see in cattle are capable of causing disease in humans, and certainly not all organisms that are capable of causing disease in humans are found in animals. So you're going to have a relatively small list of organisms that are going to fall into this group that we're going to be concerned about. The alternative with this recognition of gene swapping is the idea that any pathogen or any bacteria has obtained a mechanism from another bacteria. So this is the idea of you got infected by a bug, and that bug knew a bug who knew another bug who once got exposed to antibiotics and lived to tell about it. And they passed on that gene through repetitive interactions, and then ultimately, once it got to you, you were no longer able to overcome that based strictly upon the antimicrobial treatment that you normally would have been effective. Again, historically, we thought that we didn't understand the significance of gene swapping. And so we really thought, well, if animal pose a risk of antimicrobial resistance, it's going to be coming directly from animals to people. And so when they started out worrying about this and looking at this back in 1994, that's what they were looking at. What organisms are most likely to have been present in cattle or in animals in general and been exposed to antimicrobials on the farm and then potentially lead to a problem in human health. And so they developed this system called the National Antimicrobial Resistance Monitoring System, or NARMS, in 1994 in response to the approval for fluoroquinolones in poultry. They were recognizing already that fluoroquinolones was an important class of drugs for humans, and they wanted to maintain efficacy. And so when Bayer and Abbott came forth with their products and said they wanted to market it to poultry, there was already this concern. And so they initially started looking at salmonella from animals and whether or not that was going to be resistant to fluoroquinolones. Then they expanded it to Campylobacter, and then later added Enterococci and E. coli, and then they also have added antimicrobials on throughout the course of this program as well. It was originally conceived and continues to be executed as a three-prong approach where they look at human infections, okay, human cases of salmonella, human cases of Campylobacter, and so on and so forth. And then they'll also look at animal isolates to a much lesser extent, but that is still done to some extent, although the majority of these are coming from carcasses, not from the farm environment, and then ultimately looking at retail meat samples as well. So assuming that to have gotten from the animal to the person, it most likely went through a retail meat product. It's a good idea. It's a reasonably good program, but there's a tremendous number of holes that have existed in it from its conception and through to this point. To begin with, when they first started looking at Campylobacter, they had a selective media. And they said the selective media included nalidixic acid, which is a quinolone or a fluoroquinolone. So by definition, for an organism to be called Campylobacter, it had to be susceptible to a quinolone. And then they started going, whoops, Maybe not all Campylobacter is susceptible to quinolones. Maybe there's resistance amongst Campylobacters. So that was around about 2001, I think, that they changed their definition of Campylobacter and started looking for resistance in Campylobacter to fluoroquinolones. Their testing modality has changed based upon HACCP plans and trying to find the greatest probability of success of finding things. So there's a number of flaws here, and all of these add up to basically be saying we can't do statistical analysis. We cannot put a p-value on something and say this is significant. And so what you'll see is there's something for everyone. Everybody can run to the NARMS data, mine this data, and come out and say, see, I told you so. So here's just one screen capture from the tool they have, and we're looking at isolates from cattle, chicken, swine, and turkey from 1997 on through 2008. And we can see, you know, arguably well, they all started out really low, right? Arguably, some of them still stayed low, but notice that this is 25%. So if you're hitting 25%, that's pretty notable resistance. And cattle, you know, cattle isolates have pushed toward 25%. So this was probably one of the data sets that was leading FDA to propose withdrawal of ceftiofur, extra label use of ceftiofur in cattle, because we sure enough saw a trend, right? All discussions resort to talking about trends and what's apparent. Well, clearly there's a trend, right? That's all they can say. But they were concerned about that. If you break it down to salmonella, still looking at ceftiofur, and these are various salmonella serotypes. We're not going to get into what that means, but these are the ones that are commonly associated with cattle or commonly isolated from cattle. Wow, we had some jump up to 75% of those isolates were resistant to ceftiofur. Okay, again, no p-values, no statistics there, but that kind of borders on it's apparent to everyone that that's a problem, right? But if we go back and we look at salmonella and these same isolates and look at resistance to fluoroquinolones, it's a non-starter. There's no resistance. Okay? So if you want to say, oh, we're not causing a problem, you pull up this data. If you want to say it's all cattle's fault, you pull up that data. We can look at tetracycline, see a similar plan where some of them jump up. But there are other situations where the data doesn't do that. So while NARMS data has some value, what becomes really hard for AVMA or for FDA or for anybody else to legitimately analyze this is you can't analyze it. You ultimately end up pulling up the slide that you think best supports your vantage point and then arguing from that. So since we can't necessarily say there's a smoking gun, let's examine the likelihood of going through a pathway and what would have to occur in order for use on the farm to present a problem to human health, to public health. Well, you'd have to have the animal receiving an antibiotic in order to exert a selective pressure. The microbes are exposed to that antibiotic on the farm. They develop resistance. They retain that and carry it with them. More than likely are shed into feces. All that ultimately contaminates the carcass. They then survive to preparation. The product is mishandled in the home or in a place of preparation. Either it's not cooked thoroughly or you get cross-contamination. The consumer then becomes ill. Then that individual goes to their physician and says that they have an illness and they want to be treated. The physician then prescribes an antimicrobial, and then treatment fails due to resistance. All of those things have to occur for us to say that a treatment failure occurred, that there's a public health risk associated with using antimicrobials on the farm. So what are the probabilities of those occurring? It seems like a long pathway and seems kind of unlikely to occur, right? Well, the fact is we know that bacteria do escape from the farm and end up causing disease in humans. So these are the number of cases reported in the various years. We know that reporting greatly underestimates the significance of the of occurrence, and so it's estimated that there's nearly 2 million cases of salmonella, nearly 1.5 million cases of Campylobacter, and while not all of those come from animal agriculture origin, a very large majority of them do. So obviously we do have significant breaks where we have escaping of bacteria from the farm and making it to the consumer. Once it gets to the consumer and causes illness, then we have to fulfill those other things. That individual has to go to a physician has to prescribe an antimicrobial, and the antimicrobial has to fail in its effectiveness. We know that antimicrobial treatment is rarely indicated for diarrheal disease in humans. The vast majority of those are self-limiting, and people get over that. So we say from that vantage point, treatment failure ought to be pretty rare because you shouldn't even be treating the majority of them. But the caveat to that is there is a linkage between virulence and antimicrobial resistance. So virulence means how likely is it to cause severe disease in people. And the organisms that are more likely to cause severe disease in people, thus warranting treatment, are also the ones more likely to be resistant to treatment. And that goes back to gene swapping and the fact that when these organisms pick up the antimicrobial resistance genes, they oftentimes pick up virulence genes as well. So there's a number of things. Once you get to this point, you start going, well, it becomes really hard to quantify these probabilities. It's really hard for me anyway. A very intelligent man named Scott Hurd from Iowa State. He was a former Deputy Undersecretary for Food Safety, has done some work trying to quantify this. He's looked specifically, he and his group have specifically looked at macrolide usage in food animals, and he's come down to a very low probability of that clinical scenario occurring. And he's fond of saying that you're more likely to die of a bee sting than to have a non-treatable infection due to antimicrobial use on the farm. I would argue with him that that's poor risk communication because most folks don't like to compare those things, but he's got the numbers, and that becomes something I would not even try to argue with him in terms of the numbers. It's pretty impressive work if you want to go about reading that. So we can say, well, that seems pretty rare. That seems pretty unlikely. What about the global resistance? What about the probability that we're inspiring resistance on the farm and then that some way gets spread throughout the bacterial population and posing a risk to public health? So the basic premise there is that gene swapping can occur, and it does occur amongst a diverse range of bacteria. And heaven knows that the agriculture environment, the farm environment, does a really good job of combining diverse bugs and exposing them to diverse drugs and metabolites of those drugs. And you create a nice little fermentation vat for a lot of experimentation to occur by Mother Nature's steps. And so you can readily jump to the conclusion, well, you create that type of environment, resistance is certain to propagate and get into the environment and then ultimately threaten public health. So if we break this down to the same type of path scenario, well, what really has to happen along the way? You still have to have the animal receiving the antimicrobial, the microbe has to develop resistance, share the genetic material. All of that's, well, at least those are the same. Now we're going to get it spreading throughout the population. The bacteria has to gain exposure to humans. How's that going to occur if we're not talking about food? Well, we could be talking about food, but it's no longer just Campylobacter, Salmonella, or E. coli. It could be Enterococcus. It could be the various lactic acid producing bacteria that Bob was talking about again in milk. So there's any number of ways that these can be exposed through food. But even beyond food, well, going back to our last talk, what about eating fruits and vegetables? As much as people don't want to like to think about it, feces is just as organic and natural as anything else. And so those products are potentially a route of exposure to humans as well. Gardening, soil exposure, any number of ways that these organisms can gain access to humans. Then you get the person has to become ill, go to the physician, be prescribed an antimicrobial, and that antimicrobial fail. So we don't have nearly the same amount of information with this path as we did for the last path. So we have to start at the beginning and say, well, what's the probability of an animal or a microbe developing resistance, sharing that and disseminating it, and that basically being retained? Will that resistance be lost at some point along the way? And the answer is, well, it depends. The cost of maintaining resistance varies with the mechanism by which that resistance is conferred. And as I said, there's almost an infinite number of ways the bacteria have figured out how to evade antibiotics, and each of those carry a different cost. Some of them are inducible. That means that it sits there very quiescently, has no cost at all to the organism until they're exposed to some sort of signal that threatens them, and then they kick on their mechanism and they start pumping, and guess what? It costs them a little bit then, but it's very beneficial to them. So they're able to retain that very readily long term because it doesn't cost them anything unless it's providing a benefit to them. Others are expressed constitutively. Those do have a cost, and therefore those are more likely to be lost. The other thing is, even if we think we begin to understand where this comes from and how it emerges, or why it would, how much it costs, we still can't predict when it's going to disappear. So some experience in the EU was that they were using glycopeptides in animal agriculture. They saw emergence of significant glycopeptide resistance. They pulled those products. They didn't see the drop that they expected in resistance. And then they started looking, and they found that glycopeptide resistance was linked with macrolide resistance. And when they pulled the macrolide products, resistance to macrolides and glycopeptides plummeted. So you can't always explain that. We see the similar phenomenon with ceftiofur and tetracycline, and I'll talk a little bit more about that example here in a couple of minutes. So that's a non-starter. We can't even begin to quantify the likelihood of them losing that resistance mechanism. What we do know is that antimicrobials do persist in the environment. They continue to exert a selective pressure, particularly in an agriculture environment. We believe that that argument has some water, holds water, and has some viability. But it still becomes really difficult to quantify. It depends on what agent you're talking about, is how likely you are to find it. How long is it going to persist in the environment? Some are broken down relatively rapidly, some dissipate, or some persist for a fairly long period of time. You can argue, well, they're found at very low levels, and so they're not likely to exert a resistance. Well, the reality is low levels means that gives the organism a pretty good opportunity to survive and develop ways to deal with it and to prosper in the face of low levels of antimicrobials, and then eventually build up to the levels that they can tolerate. So that in and of itself poses a problem, particularly when there are multiple compounds present. Then that really stimulates the genetic wheels of change. So you put all that together, and we have absolutely no ability to quantify that and say what's the likelihood of animal agriculture causing global resistance. We have no ability to characterize that. If you put it on a qualified basis rather than a quantitative but a qualitative, you're still going to have variation. Some in animal agriculture are going to say, yeah, it could happen, but it's not really a risk. You have other folks saying, the sky is falling. We're going to revert back to 1940s medicine, and it's all agriculture's fault. And then you have, hopefully, the vast majority of rational individuals falling somewhere in between. So, how much usage of antibiotics are there in agriculture, and are we possibly playing a significant role in stimulating resistance? Well, the first thing you have to look at is, how do we find antimicrobials? How do we define antibiotics? What about ionophores, coccidiostats, biocides? All of these have impacts on the bacterial population. All of them have the ability to alter that bacterial population, and ultimately we have to look at which ones we're going to talk about. If you go to the sort of extreme side, the Union of Concerned Scientists has created a report several years ago now, and I imagine everybody's familiar with that. They said there were nearly 25 million pounds of non-therapeutic use of antimicrobials. They included ionophores, antiprozoals, and arsenicals. They acknowledge that these compounds have no medical usage in human medicine, probably don't pose a risk to public health, but they sort of invoke the precautionary principle and say there's not enough research to say for sure. In reality, what it does is it really enables them to bulk up those numbers. We know they're exaggerated because they actually included products that have never been marketed in the U.S. They were just been approved in the U.S., but they were never really available in the United States. So we know their numbers an exaggeration, but we really don't know how much of an exaggeration. The Animal Health Institute counters that with a statement that there was 28 million pounds total sold. Okay, this was 25 of non-therapeutic. They say 20 for food animals. They say 28 total for all animal species. And they put out the number of 10.7 million pounds with no relation to human therapeutics. Okay, so it's a different side. Is Animal Health Institute completely unbiased and science, driven? Certainly you have to look at it and say they present an opportunity for bias as well. And they're wanting to defend the status quo. So the truth, I would argue, is probably somewhere between those two extreme representations. Try to put that a little bit in perspective with human usage of antimicrobials. There's been a couple of studies that were done in adults, and they excluded some high-risk subpopulations. There's reasons to do that, but ultimately what that means is, in reality, they were looking at unnecessary prescriptions, and high-risk subpopulations arguably never have unnecessary prescriptions. If they have an exposure, they may warrant a prescription, so that's why they excluded those. But anyway, they looked at about 300 prescriptions per 1,000 person years, okay? Or on average, one person is going to get a prescription every 3 years, is what that translates to, thereabouts. Use in children is much higher. Why? We send them to feedlots, right? You take little kids and you put them into a group of unknown and dissimilar individuals, and you stress them and you share bugs, and then they get sick. It's very similar to a feedlot, and yet we get criticized for, they get called CAFOs in our side of the world, and they get called daycare over there. But regardless, you ultimately end up with a relatively high percentage, 1.89 prescriptions per child, basically is what that is per year. And even though the prescription rates were declining, the total prescriptions being written really wasn't being altered that much once you put the number of kids increasing and that sort of thing. So you add all these numbers together, and they mesh pretty well with this. These were U.S. numbers. These were Canadian numbers. You put all of them together, you're probably looking about 700 prescriptions per 1,000 years. So that's quite a bit of antimicrobial use in the human population too, right? How do you compare that? How do you compare that? We're comparing apples to oranges, or pounds or tons to scripts. It becomes very hard. And this is another one where I'm not going to touch this. This was made by an elected official. I don't know how in the world he did the math, or somebody else did the math for him, so don't ascribe this to me. But Representative Boswell has made the statement that pound per pound, humans and pets use 10 times the amount of antibiotics used in food animal production. So there we could certainly say, we are playing a relatively minor role. Again, where he gets those numbers, I don't know. But the question then becomes, well, we're using them differently compared to what humans are doing, right? Humans are using them by and large to treat disease. And maybe they're using them to treat viral disease, and that's a mistake, but they're using them to treat disease. Are we doing things differently in animal agriculture that makes it a more risky proposition than what the humans are using? And so with that, we transition into how do we use them? Does indication matter? Does it matter why the animal is being treated with antimicrobials? And the answer is no. Okay, the bug is exposed to the antibiotic, and it doesn't care whether the cow is being treated for hardware or mastitis or BRD or anything else. The bug has the same exposure. But does the route of administration matter? Yes, it does. If you're giving it parenterally, relatively low levels of that antimicrobial is going to end up in the gut, and it's going to vary depending on is there enterohepatic circulation, how's it broken down, all these sorts of things. But by and large, you have less exposure to the level of greatest bacterial population, which is the gut. If we give it orally, you have higher levels of exposure. So orally is worse for propagating resistance. Does dosage matter? Yes. If you're giving it at lower levels, you're less likely to kill the bacteria, more likely to stress them, more likely to induce development of resistance mechanisms, and therefore lower is worse too. So how do we use antimicrobials in agriculture? I think everybody here is probably familiar with these. We can use them in a parenteral manner to treat disease. We can use them either parenterally or orally to control disease. We can use them orally for prevention, and we can use them orally for growth promotion. I basically rank this from lowest risk, most defensible, to highest risk, least defensible. Okay, that's my personal opinion. You get down here and you say we're using relatively low dosages orally for long periods of time for growth promotion purposes. That poses the greatest risk. If we're up here and we're talking about we're giving it parenterally on a limited basis for a lesser length of time, that poses a less risk. Is there empiric evidence that we're creating problems or we're stimulating resistance? Well, there's clear evidence that if you give antimicrobials, the bugs will develop resistance. Ba-dum-bum. Okay? That's not really hard to figure out. The EU's got quite a bit of experience demonstrating that, where if you were using avaparsin in the EU, you were very likely to have resistance amongst enterococci on your farm. If you were not using it, then you didn't have the resistance. You saw a significant decline in resistance once you removed that product across the board in that Scandinavian population. So here's a chart plotting usage of these products and resistance. And this plot terminates a little bit early, but if you stretch it out, you go from having been pretty darn high, quite high, down to very low when you remove that pressure. So we know that usage of antibiotics stimulates resistance. How do we conclude the impact that has on public health? Well, it depends on which side of the fence you're standing on. The Animal Health Institute says, you know what, big deal. There's no evidence of a public health benefit, and we know that disease occurrence went up. If you're at the WHO, the World Health Organization, you said, well, we reduced antimicrobial use with fairly minimal impacts on animal health. We know we reduced resistance in general. That's a good thing. That in and of itself is a good thing, and we're happy about that. They will concede that the data is sparse on human health effects, but if you go back to that path analysis, it becomes really hard to go from point Z and tag it all the way back to point A. So they basically say if we can reduce resistance, it's a good thing. But again, it depends on which side of the fence you're standing on. What other evidence do we have suggesting we're impacting antimicrobial resistance? This was a study done by Guy Lonergan's group down at West Texas A&M. They treated cattle with ceftiofur. They had a control group, and then had a group treated once, and then twice, and then 3 times. This was a sustained acting exceed product that they were looking at. And sure enough, when you treat the cattle, the E. coli that you get in their feces is going to demonstrate resistance to ceftiofur. That was transient, and it declined over time. But what you saw was an incomplete linkage to tetracycline resistance. If you gave the animal ceftiofur, you saw resistance to ceftiofur and tetracycline emerge. And then if you stopped the ceftiofur, you saw the ceftiofur resistance decline. The tetracycline declined some, but not all the way to base level. If you fed tetracycline, you saw tetracycline resistance in the absence of ceftiofur resistance. And you remove a tetracycline, and that tetracycline resistance stayed there. Okay? It just generates job security for folks who are looking at this disease, this subject, because it's very confusing and it's very difficult to predict. So this is the graph that they generated. This was a control population where you really saw very, very, very low levels of resistance to ceftiofur. This top line was a group that was treated 3 times, basically treated back here and then treated again here and then there, and then by the end we basically returned to baseline. So there obviously is a cost to maintaining ceftiofur resistance, and you remove the pressure, the resistance disappears. But that's not the case with tetracycline. Okay, so it's just a rather complex situation, and so we can say if we're in a feedlot, this probably is irrelevant, right? Because that animal is going to probably be treated for BRD at the beginning of the feeding period. They're going to have another 80 days before they get finished. This is really going to tail off. What if we're talking about a dairy cow that's being treated, and she may be culled as soon as that 13-day withdrawal period is up? Then maybe that poses a risk. Where is there evidence, or is there evidence that agriculture is not having an impact on antimicrobial resistance? Ionophores, in my opinion, are wholly 100% completely defensible. There is absolutely no evidence that they impact resistance of public health importance. There's quite a bit of data that says that that's not a problem. But if you get, and even that was originally recognized by the EU, where they did not exclude ionophores, but ultimately the precautionary principle got the better of them, and they have removed those products from the market for growth promotion purposes. You get to the precautionary principle, they say, well, we have no evidence of impact, but that does not constitute evidence of no impact. Well, it becomes really hard to prove a negative. Have you ever tried to prove Santa Claus doesn't exist? You know, it becomes very hard to do. So at what point do you say we've demonstrated enough that there's no impact? So what can you take from all of this? My personal thing that I think is wholly defensible scientifically is use of antimicrobials stimulate resistance. We use antimicrobials, therefore we're playing a role in stimulating antimicrobial resistance. The only way you can avoid it is don't use them. Now, the next step is, in my opinion, to acknowledge that some uses pose more of a risk than others. And then we need to start parlaying out, okay, how significant is that and how important to us is it to fight that fight. I think it is still unclear and very debatable whether or not we're a major or minor driver of resistance, and that's something that still needs to be worked out. But in my opinion, again, we must be willing to modify our behavior based upon the recognition that there is a potential that we're having an impact. And then similarly, we also must be willing to call out and disagree with those folks who are making the more outlandish claims that are ultimately detrimental not only to animal agriculture, but in the long run to human welfare overall, because you're taking away our ability to produce a safe, wholesome, and abundant food supply. So with that, I'll leave that up here. If you can memorize this and regurgitate it at the end of the symposium, then you'll probably have an understanding of the complexity of antimicrobial resistance.